Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. And we're helping El Paso help their pets. So here in El Paso, we've been seeing a lot of parvo recently. We always see a ton of parvo here in town, unfortunately, because there are a lot of unvaccinated dogs, there's a lot of stray dogs, and there's a lot of miscommunication as to when and how long our pets should be getting vaccinated. We hear a lot from people that they are told that the dogs no longer need to get vaccinated for parvo after they're puppies, and this is totally false. Also, in addition, we've been seeing more of a problem recently because we've been having breakthroughs because of a new strain. And so what's happening is that new strain is harder and heavier, and it's actually breaking through, and dogs that are fully vaccinated are also getting parvo. So the good thing about it is if they are fully vaccinated with a vet clinic, then a lot of times we can contact the vaccine company and we can get you some support, some financial support for the treatment of your pet. But the main thing is we want to prevent that. So in our clinic, we have actually changed our vaccine protocols. And I'm going to go into that a little bit, because even if you don't take your pet to our clinic, or even if you don't live in El Paso, it's important to have this information, and you may want to talk to your veterinarian about it and ask them to do some of the research to see if they want to adopt this new protocol as well to keep your pets as healthy as possible. So typically, most dogs get vaccinated for the distemper parvo, which is actually a 5-in-1. I'm just calling it distemper parvo, but it's actually, we call it DHPP, and it's a distemper, hepatitis, adenovirus, parainfluenza, and parvo vaccine. And that one is typically given at 6 weeks, 8 weeks, 12 weeks, and 16 weeks. So about after the first pre-booster, then it's about every month. Now the change has come in that at the 6 weeks vaccine, we're no longer giving a DHPP, but we're just giving a DP, meaning a distemper and a parvo. And this new DP has the new strain of the parvo virus, so that we can protect those young puppies against this new strain. So in our protocols, what we recommend to our patients, because again, we want to practice best medicine and keep up with the times because things are always changing. So at the 6 weeks, we would do the DP. We would do a fecal test because we see a lot of intestinal parasites here in El Paso in our pets. Those intestinal parasites can pass to you and your family and your other pets. And sometimes the puppies look totally normal and healthy and active and have normal stools. And so we want to make sure that they're not carrying something that they could pass on to you and that could make them sick later on. So we do at 6 weeks, we do the DP, the fecal test, and we go ahead and start them on a dewormer to protect them from any parasites that are not being produced enough in the body to show up in the fecal. And then we come back in 3 weeks, so now we're doing every 3 weeks. We come back at 3 weeks at the 9 weeks, and we now do the DHPP, so just like normal. We also do another deworming because we know that puppies commonly carry intestinal parasites. And we also at this time start on the heartworm, the heart guard, and the next guard. So flea and tick and heartworm prevention. Super, super important, especially in our area. We come back in another 3 weeks. At 12 weeks, we do another distemper parvo. We now add on the bordetella at this time. Our clinic personally does the intranasal bordetella, which is good for a year, and we no longer have to give boosters. So it actually saves you some money, because instead of doing the 2 bordetellas as puppies, we are now only doing 1 because we're doing the intranasal, and it's a more effective vaccine. We are also doing, so in addition to the DHPP and the bordetella, we are also doing the flu at this time. So again, remember, flu is becoming more and more common. It is highly, highly contagious, and it does cause severe disease where they do have to be hospitalized. So to save yourself some money and your pet the illness and potential complications with that, it's best to get that vaccinated. Even though we don't have it currently in El Paso, we want to protect our patients so that when it gets to El Paso, they are already protected. We also, again, do the heart guard and the next guard, as that is going to be repeated so that we can get them on that and prevent any heartworms and distemper and fleas and ticks. And then we come back in another 3 weeks. At 15 weeks, we repeat the DHPP, we repeat the flu, and we now give the rabies. So again, remember, they don't need a Bordetella booster, but they do need the rabies at this time, excuse me. And then of course they would get their heart guard and their next guard again, okay? Now the other 2 things that are added on, so normally that would kind of be the end of the series, but again, because we've been having breakthroughs and we want to protect everybody, we've added on 2 more vaccines, which is just the DP for that new strain at 18 weeks and 21 weeks. Now, to help out financially, we are not charging an exam. We will still do the exam on your pet to make sure that they're healthy enough to get their vaccine, but we will not charge for it for this 18 and 21 week booster, as long as they're healthy and everything is going okay and all they need is the booster. Okay. In addition, we're helping out financially. The DP is actually more expensive for us, but we are keeping it at the same cost as the DHPP so that people can afford to do it. And you know, that is our gift back to the community to do our part in reducing how many parvos we have. So we want to keep everybody healthy and prevent those parvos. Remember, it's really important to keep up with the heart guard and the next guard. We have been seeing tons and tons of tick-borne diseases recently. I can post another video on that so we don't get too long on this, but really, really important, even if you are not seeing ticks. I just did a family yesterday who's never seen a tick on their pet, and 3 out of their 4 dogs came up positive for tick-borne diseases. So super, super important. These can be deadly. Also, remember, the microchip is important. That can be done at any age. A lot of people like to do it when the pets are under anesthesia, but they can be done at any age or any size. Okay? If you have any questions, please feel free to comment, like, and subscribe. And we will be doing more videos. I know we've kind of slacked off lately, but we're going to get into them. And we're also going to be doing a couple of animation videos, which will be kind of fun. So stay tuned. Check out our Facebook and our Snapchat, because we post a lot of bloody and gory and fun stuff on our Snapchat. Have a wonderful day, and if you have any questions, let us know.